Okay, so we're finishing up a case that we kind of had already started a while back. So we did some upper teeth on this a little while back. And so today we needed to finish up the bottom teeth. So I've got to take off some old crowns. Wait till you see when we finish up this case. It's gonna look really good. You relax, you take it easy. We'll take good care of you, buddy. So first thing first, I gotta get him numb so he's super comfortable, right? And then now that we've got him numb, one of the main things I need to do is take off 7 E-Max crowns. E-Max crowns are a little tough just because they are a thick, hard material and they're bonded to the tooth. And we're dealing with small, skinny teeth on bottom. So I gotta be really, really careful as I take these off. This material that we're cutting through here is called zirconia. It's gonna take me a few burrs to cut all this off. Now I gotta clean up any decay. There's a couple of spots with cavities that we gotta bond and fill and clean all that up. Put a little filling right down in the bottom there, and then we can put a crown over the top of that. Once we get the cavities filled, then I gotta get the impression. So that's where you're gonna see me spend a lot of time tooth by tooth by tooth, pushing back the gums, adjusting those a little bit so that the scanner can see the edges of the tooth. This is the most critical part of every appointment, where we can see the edge, or what we call the margin of the tooth, so that it meets up there. Once we get that, we're home free. All we gotta do is make him a few temporaries, lock those in, make those look good, and then he's set to go for the day. As many of you guys know, I'm always trying to avoid prep wherever possible, but I get a lot of patients who've already been prepped, right? So we have to take off crowns, and my goal isn't to over prep anything else. In fact, all I'm gonna do is clean up cavities and then shape those, keep them really, really clean so we don't prep any more than we ever have to. Okay, really complicated case. You can tell his bite was deep. Everything was a little tough right around the edges, but we got everything cleaned up, all the decay removed, ready to go. We're gonna match his bottom teeth to his top teeth. And we just got his impression. Now we're just finishing up temporaries. He'll be good to go for the day. We got everything we needed to do on John. He's in temporaries. He's gonna be in those for just a couple of weeks till he comes back, and we're gonna deliver some of those finals. Step by step, we're getting John kind of rebuilt from teeth that had kind of been all over the place, in bad shape, few implants, all that stuff, to where he's really coming together and putting this whole mouth together.